Hi, Shaun.
Hello.
First of all, can you tell us a little bit about yourself?
Yeah, so I'm on the presidential team with your good self. I'm chair of the IOSH Construction Group, and I work for a company called Tetra, and I've been working around the Building Safety Act, since its initial sort of consultation as a bill, worked on a few working groups, and as a business we've been working into delivering things like safety case reports, resident engagement strategies and systems for mandatory occurrence reporting for clients.
Wow. So why do those working in occupational safety and health need to know about the new Building Safety Act?
Well, it's such a fundamental shift, I think, in how we sort of regulate buildings, in particular how they're built and the quality of buildings, but also it has big impact on other legislation, things like the construction design and management regulations, which we use, of course, to manage the health and safety risk for workers who are working into that process. So I think now there's a real overlap between those two different dimensions, the quality of the buildings we deliver so that, occupants can be safe, the buildings have a good legacy so they're not sort of, falling into disrepair over a short period of time.
Yeah.
But also the responsibility perhaps to incorporate that into our traditional approach, which is, let's make sure everyone goes home safe and healthy at the end of the day.
Definitely. So I suppose that leads on to how important is competency within this area?
Yeah, so during the presentation I was talking a lot about competence, and it's a really key focus, I think, for the regulator, the new building safety regulator that's kind of been sort of developed out of the HSE. Competence has always been important, but I think in this regime it's particularly important because it's not just about the competence of the people that build the buildings, it's about who delivers services into those buildings, but also people advise on it. And that's why I think as a community of health and safety professionals, we need to acknowledge that, because we're going to be part of that picture going forward. So we might be, educating and informing people, influencing, people that have responsibilities within buildings that aren't health and safety professionals, but nevertheless, they need to kind of raise the bar when it comes to their own levels of competence.
So how should the occupational health and safety professional integrate building safety into our responsibilities?
That's a really good question, and I think a lot of health and safety professionals are sort of beginning to work into this area. So they might not have done it before if they're working in a completely different industry like manufacturing. I've sort of spoken to a few who have ended up working in property, facilities management, for example. Anywhere where there's buildings to be managed, some of those buildings will probably fall under the Building Safety Act. I think it's also worth remembering that there is a provision in there which allows for the Building Safety Act to be extended in scope to cover all buildings. So at the moment it's higher risk buildings, those over 18 metres or 7 stories with 2 residential units, which of course could be a commercial building, a mixed occupancy building. Going into the future, we might see that scope broadened out. I've already heard that certainly in the commercial sector, they're looking at things like the safety case regime and thinking, do you know what, that's actually a really good way of managing a building. Maybe we need to think more about the golden thread. So I think there will be, even if it doesn't come in explicitly through legislation, I think a lot of people will look at what's happening in the residential sector and the mixed use sector and think, do you know what, we should probably raise our bar to meet those requirements anyway.
No, well, thank you so much for your time, Shaun.
You're welcome.
Thank you.